You're watching EAC News. Thank you for joining us. The United States Embassy in Cambodia has pledged to continue supporting the kingdom's fight against COVID-19. This was announced during Tuesday's virtual media briefing, joined by the World Health Organization, UNICEF, as well as the Ministry of Health. US Ambassador W. Patrick Murphy has also announced that they will be providing 100,000 sets of PPE to Cambodia's HIV healthcare facilities over the next week. Ministry of Health spokesperson Dr. Vandine says the US Embassy's contribution is a huge help. EAC News reporter Rayo Soko attended that briefing.
The Health Ministry's Dr. Vandine has expressed gratitude to the U.S. Embassy for its essential partnership with Cambodia since 1992. U.S. Ambassador W. Patrick Murphy stressed that they will continue to provide help. Since the outbreak, the U.S. has already provided supplemental funding of over $15 million in direct support to Cambodia's fight against COVID-19. In July, over 1 million doses of the single-shot Johnson & Johnson vaccine were provided by the U.S. through the COVAX initiative. When asked if the U.S. will provide more vaccines to Cambodia, Ambassador Murphy says that it will be up to COVAX, which they are working very closely.
The United States is working very closely through the COVAX mechanism, which is a global mechanism partnering with countries to identify where the needs are for vaccines. So that will be a conversation between Cambodia and the COVAX facility. The United States is a huge donor to COVAX with cash, $4 billion, and a continual supply of vaccinations. But it's that mechanism that identifies where the needs are most pressing and most urgent. So that really is between Cambodia and COVAX.
UNICEF representative Foro Fuyasat has confirmed that more vaccines are coming to Cambodia through COVAX.
Is going to receive more vaccines through COVAX. And as Mr. Ambassador mentioned, the US government is the largest donor there, both in Q3 and also already for Q4, there has been communication to Ministry of Health, and it's currently for the ministry's decision how to avail of the Q4 share through COVAX. Over.
As of Monday, Cambodia has already vaccinated 97.58% of the targeted 10 million population, while 71.79% of its total 16 million population, including children aged 12 to 17, have been fully vaccinated. The kingdom is using Sinovac, Sinopharm, AstraZeneca, and Johnson & Johnson vaccines for inoculation. In July, the Ministry of Health announced that private companies may now import and distribute COVID-19 vaccines for use by private healthcare facilities, provided those vaccines are WHO approved. EAC News asked the Health Ministry on the progress of allowing private companies to import vaccines which are not available in Cambodia. Dr. Vandine has answered that the private companies and hospitals who have shown an interest are in the procurement process. She says the government is now aiming for a new normal and already well prepared to open up some sectors, including tourism. But the reopening of tourism will depend on people's cooperation. WHO representative in Cambodia, Dr. Lee Ailan, also says that right now, the priority in Cambodia is to respond to the Delta variant.
We had the good news that our transmission not very high level, but it's too early to conclude. So the top priority that WHO advised and is supporting to the government, in particular Ministry of Health, is really to have effective implementation of a combination of three things. First, effective non-pharmaceutical intervention. Second, speed up the vaccination program to reach all the vulnerable population, protect all the vulnerable. Thirdly, is the healthcare capacity strengthening, including ICU capacity. I think this is a top priority. However, it's the best opportunity to plan for the reopening, including the opening border for the tourism.
Ailan has emphasized that the WHO, Ministry of Health, and other sectors are currently discussing the option of living with the virus in a new normal. Rhea Soko, EAC News.